I stood outside Afya House, and it is on record even in the media. I pointed at Afya House, and I said that there are many cartels in this building. You know, I said it myself. It was not said by other people. I am the one who said it sitting in there. So as I went into the ministry, I was quite aware that there are cartels. And I'm quite aware that even this one, there are cartels in it. That's the first thing. The second thing is to say that cartels fight back. You know, cartels will fight back. And some of the stuff that you're hearing coming out is a question of cartels fighting back. Not only would I expect them to fight me back once you start fighting them, in fact, I'm ready for the battle because I know the battle is going to come. And the cartels will definitely fight back. But I want to say that irrespective of the war that is clearly going to be there, there are sufficient people in Kenya. There are enough people in the ministry, there are enough people in this parliament, there are enough people in Kenyans out there who are going to be extremely supportive in that fight. You know, I am confident about that. And your job in this house, as you oversight, as you make sure that you oversight, is also to make sure that you assist us also, you know, in those battles with cartels, that you'll obviously come and fight back so that they can take. In the area of COVID, for example, and I pointed it out, is that as we started the restructuring of KEMSA, and I want to say to Honorable Koech that, you know, it is very difficult for us to remember back at the crisis that we had in 2019, and as particularly after the 12th of March of 2020, when the pandemic was actually declared globally. Mr. Chairman, we were faced by a severe situation. What we are calling, what today sells for nothing, which is a mask for your face, was so rare that people were willing in the streets of Nairobi to pay 3,000, 5,000 shillings for a mask, which is now free in most places and you can take. So when people say, and part of the big question regarding that period and part of the COVID billionaire issues and so on that we have had to do with the prices of issues, the prices of goods, the prices of commodities and health, and what was necessary to contain this disease in our country. Mr. Speaker, I remember appearing in this house to explain these issues and to say at that time in 2020, for example, we were looking for anybody who could give us a mask. And yes, I am the first person to admit that it wasn't an opportune time, that indeed there was abuse of process in KEMSA and other procuring agencies at that time, and not just in the Ministry of Health, but widely. But I think the major concern, the major interest at the time, and I can give you one clear example. For instance, the PPEs. We were looking for protection gear for our doctors and nurses. We didn't have any. A PPE could easily sell for 15,000 shillings, 9,000 shillings, etc. And I can tell you, Honorable Koech, that if they came at 20,000 shillings, we would have bought them. Because it's a question of, are you going to wait or are you going to buy at whatever price to save lives? Money almost begins to take a secondary position when it comes to life and death. And that is what it was. But we are also the same people who worked on it. What steps did we take? I called all the manufacturers of the materials. I sat outside my office with a bottle of water, testing materials to see whether they could be able to be used for PPEs with the experts in the Ministry of Health. And consequent to that, we were able to use our own people in Shona, in Athi River, in Nakuru. We were able to use our own people to produce the same materials at a quarter of the price. And now today, the same PPEs can be produced in our country at 2,000 shillings or less than 2,000 shillings. So it wasn't an appropriate time A lot of mistakes were made, and I'll tell you that and confirm that indeed there were mistakes made. But I would also like to say that at the prices that I was saying, and this is what I explained to Parliament, and I challenged this House, at the time that we were buying PPEs at, say, 9,000 shillings, I said I would like somebody to show me any place where the PPE was selling at less than that price. And I remember, Mr. Chairman, going to Aga Khan Hospital, going to Nairobi Hospital. Everybody was desperate and the prices were crazy all over the town. It wasn't that the Ministry of Health was buying those items at a higher price than the rest of the world or the rest of the country. We were buying it at the market prices at that time. And this is something that I have explained,